Hello friends, myself Dr. Veena's Academic here with my YouTube channel, that is DR.VEENA'S Academic Realm for nursing education. And today I am with you all with new topic from the nursing research, that is one of the very important topic, that is problem statement from the first step of the nursing research, that is problem statement. So today I am going to have a discussion, or we can have the clarification on the one of the topic, last aspect of the problem statement, that is formulation of problem statement, which is most important step of nursing student, nursing faculty and PhD scholar to formulate the problem statement. So today's topic, let us start with the introduction and then we will have a highlights on the formulation of problem statement with example. Let us start with the today's topic. Like first we will see the what are the steps of formulating the problem statement. So first is a selection of area, specific selection of area of the problem statement where we are going to conduct the research. Second, finding out the review of literature related to topic. Third thing is a delimiting the area where we want to have a very specification about the research area. Then next is we are going to have the different evaluation of the evaluating the research problem statement and evaluating the research area. And then last, most important is formulating the problem statement. So we'll see one by one each aspect of each step of formulating the problem statement. So first is a selection of area for the research. How do I am going to select the area for my research? So sometime we may find very difficult to find out the area, like broad area to the very specific area. So first let us see the what is broad area of my research study. For example, if I want to conduct the study on specifically under the area of medical surgical, medicine and surgery. So I am going to have like this is a broad area of research. So how I am going to come to the specification. So first I should able to find out the area of research study, that is a broad area, and then going to the very specification of the research area. So these, for example, like a medical surgical nursing, I have found out this is the area where I am going to conduct the study. So under that I am going to stick with the medical nursing. So this is my broad area of selecting the problem statement. That is the first step of formulating the problem statement. Second step is a review of literature, finding out the review of literature. So I will come to know that review of literature of specific topic, like for last 5 years, or I will find out the different journals, newspapers, websites and different library literature. So I will find out review of literature of that specific area, like medical surgical nursing. And then that time I come to know that there is a something called as under medical surgical nursing endocrine system. So endocrine system, I will find out the what is endocrine system, what are the diseases, what are the problems. So related to that clinical area and theoretical knowledge, I will correlate and then I will find out the review of literature of specific area. Again, one more example for the specific area after the selection of problem statement, like then endocrine, I come to know that diabetes mellitus is a common problem. According to the World Health Organization, diabetic mellitus is a non-communicable disease which is very much in and prevalence in the like specific area. So I need to know that what are the problems of the diabetes mellitus, and then I come to know I will have a study on the diabetes mellitus, its complication and management. So I come to the specific broad area, medical surgical nursing to the endocrine to the diabetes mellitus, and then I will find out the review of literature to specific area. So this is the second most important step of formulating the problem statement, that is finding out and working out on the review of literature of specific part of the research area. Third step of the formulating the problem statement is delimiting the area of research study. Delimiting. What is delimitation? That means I am going to vary from broad area to the very specific area. Like I said, medical surgical nursing. Then I go to the endocrine system. Then I find out the review of literature for different disease condition of endocrine. Then I come to the diabetes mellitus, and very specifically then I come to know complication of diabetes mellitus, where I can find out, like for example, peripheral neuropathy. diabetic peripheral neuropathy is very most common complication of diabetes. So I come to know that this is my specific area. I'm going to work out on this area for my problem statement. Then the study becomes like a very specific intervention on the peripheral neuropathy or some knowledge related studies on the peripheral neuropathy. So I am going to delimit my study from very broad area to the specific area. That is from the medical surgical nursing to the different diseases, then endocrine system disorders, diabetes mellitus, and from diabetes mellitus to the peripheral neuropathy, which is a complication of diabetes mellitus. So this is the best example for delimiting the area of research study. So now this will be the time where I will be very specific, clear about my problem statement or area of research study. Now next step for the formulating the problem statement is evaluating the problem area or evaluating the problem statement or whatever I have selected. Why there is a need of evaluation of this problem statement or area of research study. So I need to see about the cost wise, feasibility, then the permission, administrative permission, ethical issues related to area of my study. So why this is most important step of formulating the problem statement, to check the feasibility, cost, even the cost of the traveling, cost of the printing, and administrative permission, whether there is any ethical problems related to conducting the study. So I will come to know that whether this problem is researchable, whether this problem is feasible to conduct the study, whether I will have a problem or whether I will able to complete this study. So for this reason, we need to we need to study on the evaluation part of the problem statement in all aspects: financial aspect, researchability, feasibility, cost wise, then per administrative permission, whether it is significant to the profession. So I will evaluate that problem statement. That is a step of the formulating the problem statement. Next and last step of problem statement is formulating the problem statement. Actual putting the problem statement in the word, in the content. So after checking the researchability, feasibility, significance to the profession, cost wise, so I will come to the conclusion that this will be my area of study. And then I will start formulating the problem statement. So how I can formulate the problem statement? So there are two methods, or we can say there are two types of problem statement I can formulate. First is a declarative format. Declarative format of putting the area in the statement form, or interrogative form. So there are two types or two patterns of putting the research area in the problem statement or statement of the study. So let us see one by one about the different types of formulating the problem statement. So what is declarative statement? Declarative problem statement. So declarative problem statement is what? It is a declaration, or we can say it is a statement. Declarative statement for the formulating the problem statement, which is one of the very important type of formulating the problem statement. So how we are going to put this problem statement as per the declarative format. So for example, like the study to assess, a descriptive study to assess prevalence of bed sore among the unconscious patient admitted in the selected ICUs of the particular hospital. That can be one of the example of declarative statement. So there is no question, it is a statement. Second example I can give, the descriptive study to assess the stress, coping strategy, quality of life among the women suffering from selected chronic diseases of particular areas of setting. So this will be again the statement. There is no question, but there will be a researchable variables, there will be a setting, there will be a type of study. These are the two examples for declarative statement. Second, what is interrogative format of putting the problem statement? So interrogative, you can understand, it is a questionable or question form of the formulating the problem statement. So question form, how we can formulate this problem statement? Like for example, it will be in form of question, like WHO type of question. So what will be the effect of hemoglobin level on the work performance of the working woman among the selected areas of different state, we can say. So this is a what, starting from the what, that is a question, that is a interrogative format. Second, what will be the prevalence of children suffering from particular diseases. So this is again form, WHO form, that is a question form, formulating the problem statement. So there are two types of formulating the problem statement or writing the format of problem statement. That is one is a declarative statement and second is interrogative statement. So example I have given, one will be with the statement format and one will be with the question pattern. So there will be like question in your mind. So what type of problem statement I should formulate, or what format I can follow to put the statement in particular format, whether a declarative statement or whether it is an interrogative format. So it depends on the policy of particular hospital or institute or ethical committee, how you are going to put the problem statement as per the type of or area of research study. But majority, like we can see about the problem statement in nursing profession or nursing education or nursing research, we can say we follow the problem statement formulating. Many time it is a declarative format, like there will be a declarative statement or formulating the problem statement in the nursing profession. So when we see the problem statement as a declarative statement in the nursing profession, we have to have like 4 aspects of problem statement, or before you formulate, we have to see the whether it is related to some area, specific area. We have to study about the different settings, availability, feasibility, and then ethical consideration or ethical clearance, we can say, before selecting the area, before selecting the area of research. So we need to work out on this before we formulate the problem statement. And commonly we should have, like in problem statement, very important 4 aspects. That is, first is there is a type of study is most important, which is the most important type content of the formulating problem statement when we follow the declarative format. So type of study is most important. Second is setting of the study is most important again. Then population of the study and variables. Variables in the problem statement, declarative statement. So variable, it is, if it is a experimental study, so there should be a 2 variables, independent and dependent variable. And if it is a non-experimental study, there should be a researchable variable. So formulating the problem statement has a 2 types, that is declarative format and interrogative format. But we follow, like in nursing profession, declarative statement, which has a 4 aspect. Again I repeat, type of study, different variables, setting up the study and population of the study. So here I conclude this today's topic about the last step of the problem statement, that is the formulating the problem statement. And what are the steps of formulating problem statement, what is the review of literature, why it is necessary, what is the delimitation of formulating the problem statement, and why we have to evaluate the research area and problem statement, and how to formulate, and what is the format of formulating the problem statement in nursing research. So hope you understood today's topic. It was very short but very important topic of the nursing research, and hope you understood. And thank you for watching this video.